Ben, what do you think about that trial TASTE?
I know there was a lot of stuff that came out today. The TASTE trial, interesting, 7,000 patients, a little bit more, with ST elevation myocardial infarction, were randomized to either thrombus aspiration before PCI or PCI alone, and really no difference at all in terms of overall mortality. And that was regardless of whether there was a large thrombus burden or not, whether it was an anterior or inferior MI. So it does throw into question, I think, a lot of the data we've been using from the TAPA study about how to best manage these patients with ST elevation MI.
Yeah, so this is a Swedish, Danish, and Iceland study enrolling a huge percentage of all the people who had infarctions, finding no benefit. Now, do you think, is there anything in there that would it help us identify which patients might benefit? Were there any subgroups that stood out? Because sometimes it's said that high clot burden would be appropriate, but I understand there were no real interactions here.
No, nothing came out that the people with the highest burden still did not see a benefit if they had a lot of clot. I think there's additional stuff that will be interesting. I mean, maybe the duration of symptoms before onset. But I think overall, a very neutral finding in a procedure that we thought was giving a lot of benefit.